Deliver me, maternity. Thank you, nurses.
Hi, I'm R.L.M Ross. Welcome to another episode of Deliver Me, the video series. Today we're going to be discussing Chapter 7 from my book, Deliver Me, The Real Deal from a Labor and Delivery Nurse. If you have not yet gotten your copy, it's available on Amazon.com, Kindle and paperback version. The chapter we're discussing today is Chapter 7, the immediate postpartum period. Now, what we're going to be talking about is that time immediately after your baby is born, because the postpartum period extends up to 6 weeks, all right, after delivery. During that time, your doctor is going to deliver your placenta. We're going to stimulate your baby, warm up your baby, dry your baby off, and help your baby transition to extrauterine life. Your doctor is going to repair whatever tears you may have. He is going to deliver your placenta. I said that already. And we're going to band your baby for identification purposes to make sure that nobody walks out, steals your baby or anything like that. That's a really important part of the whole process, and it's done immediately postpartum. During this time, we try to encourage breastfeeding. There's a process called skin to skin where the baby is put on your chest. Some mothers want that to happen like right away. Whether it happens right away or not is very, very dependent on a number of things. How you are doing and how your baby is doing. If your baby comes out limp and it needs some additional help to transition to extrauterine life, skin to skin is not the priority. If your baby comes out and you're bleeding excessively or you're having some kind of obstetrical emergency, skin to skin is not the priority. Usually after everything has calmed down and everybody is safe and we're comfortable that everybody is safe, we will initiate skin to skin. This helps the baby to bond with you, and for those of you who want to breastfeed, it helps the baby to learn who you are, and then the baby kind of at some point will give you cues that he or she wants to try and nurse. But usually we encourage the skin to skin bonding before we encourage nursing, and we teach you the cues to look out for so that when the baby is ready to nurse, you can put the baby on your breast. So that is why sometimes you don't do skin to skin immediately. Usually it's done within 20-30 minutes of delivery, but it's not usually done immediately upon delivery. Another question that usually will follow this one: do I have to breastfeed within the first hour of the baby's life? What do I do if I'm exhausted? It is recommended that you breastfeed if you're planning to breastfeed your baby within that first hour, right? I find that the babies usually don't want to nurse until after they're an hour old. So we'll do skin to skin, and they'll be there and they're against your chest, and they're learning who you are and getting comfortable with the smell of you and just getting used to being outside. Some babies will appear to be very alert, some will be very sleepy, but once we're comfortable that they're breathing comfortably and there are no issues, they can stay on your chest and they can do skin to skin for as long as you both want to. If the baby starts to give cues that they want to nurse, then we encourage you to try and put the baby to the breast, and you'll be assisted with that procedure. If you're exhausted and your experience has been like a really, I say difficult, I don't want to use the word difficult, but like you had a long labor, you pushed for a long time, and you're just tired, because fatigue and tiredness is a hallmark of the whole labor and delivery experience. So if you feel tired and overwhelmed and you don't feel up to nursing your baby, that's fine. Nothing will happen, okay? The baby has up to, depending on the size of the baby, has up to like about 20 hours to eat before you really have to feed the baby. We try in hospital setting to give the babies something within the first 3 to 4 hours of life, but it really is not necessarily necessary. However, if you're really tired and you really don't feel like you're up to it, there's no harm in waiting and giving the baby a bottle if you're very concerned about what the baby is going to eat. But babies are very hardy. They don't really feel hunger on the inside. They come out. They have to learn to associate sucking on your breast with that empty feeling or that full feeling in your tummy. So it's all a learning process. If you have nothing to give, if you're really, really tired and you have nothing to give in terms of yourself, then you won't be able to do right by your baby or do for your baby. So it's best to take care of yourself first. Take care of your needs, and then you address the needs of your baby. Some patients ask, why do you keep pressing on my belly? It's already sore. This is something that happens very frequently in the immediate postpartum period. What we're feeling for is your fundus. Your fundus is the top of your uterus. The uterus is where the baby was for the 9 months. Inside your uterus was where the placenta was. And once the placenta has been delivered, there's like a whole raw area there that oozes, because that was the area that had all the blood vessels that supplied the placenta and your baby with nutrients throughout the 9 months. So think of it as a big, raw, sore area. And we just have to, it's like with any raw cut or anything like that, you have to apply pressure. So what the muscles of the uterus do is clamp down on this area. And so with clamping down, they essentially try, you're applying pressure and cutting down on the amount of bleeding that you're doing from the placenta, from that placental area where the placenta was. So we keep pressing on your belly to make sure that that fundus or that top of your uterus stays nice and hard. The harder it is the more we're convinced that it's clamping down on those blood vessels that are there in that big raw area that used to host the placenta. So we rub on it to make sure it's hard. If it's not hard, we rub on it some more to make it hard. And what I've been doing, been showing my patients what I've been doing so that they can feel for it too and understand what it is that I'm doing. But pretty much it's just to keep you safe and make sure you're not bleeding excessively. How long will you bleed for? The bleeding actually goes on for 6 weeks, but it decreases in amount and color as the weeks go by. The first 48 hours, you should have the heaviest bleeding. It's going to look like a heavy period immediately after you deliver. It should not be excessive. What we're doing a lot now in labor and delivery is weighing pads to quantify the amount of blood that you're losing. So you'll find that your nurse will take your pads and she'll weigh them just to make sure that you're not bleeding excessively. All right? Bleeding excessively is an obstetrical emergency. So it's something that we look out for and try to avoid. But as the weeks go by, the bleeding slows down and the colors change. If you start to have heavy bleeding again, say a week or two after you deliver, you need to go and see your doctor. If you start to have a foul smelling discharge or the blood starts to smell bad, you need to go see your doctor. That's a problem. All right? Other than that, it should taper off, and by the time you get to 6 weeks, it should only be like some spotting, and it should be like a almost whitish discharge. That's what you should be having. So that brings us to the end of this episode of Deliver Me, the video series. Remember to get your copy of the book at Amazon.com. It is available in paperback and Kindle versions. If you would like more information or you'd like to ask us a question, follow us on Instagram at R.L.M Ross Books. Like our Facebook page at Deliver Me, the real deal from an L&D nurse, or email us at rlmrossbooks@gmail.com. Thanks for tuning in to another episode, and thank you for your support.
Labor and delivery, deliver me, maternity, all this hard work for kids around.